Assalamualaikum warahmatullahi wabarakatuh. The honorable judges, the world is fighting against the COVID-19, a disease which has no cure yet. The countries around the world are still trying to diminish the virus transmission as the number of the sufferers is increasing day by day, especially in our country. Can the virus spreading be controlled? Our government has implemented several ways of battling the virus transmission. There are at least 4 strategies that have been taken. First, the mass movement. People must wear masks while they are in public places or outside their houses. 2. Contact tracing of positive cases treated using a rapid test. 3. Is to educate and prepare isolation independently on some tracing results that show positive test results from rapid tests. And the last is hospital isolation, which is carried out when self-isolation is not possible. The great action that the government has implemented is large-scale social restriction implementation, or PSBB. Several regions have implemented it for a certain period of time. Many people call this rule the quarantine. Now, I will focus on talking about this quarantine because there are the pros and cons in the society. What is self-quarantine or isolation? According to Wikipedia, quarantine is a restriction on the movement of people and goods, which is intended to prevent the spread of disease or pests. The quarantine system is identical to the isolation of a person or object that will enter a country or region. The term quarantine is often equated with medical isolation, which is the separation of individuals suffering from an infectious disease from other populations who are still healthy. And we have been implementing it for 3 months. During the first 3 months of quarantine, people need to do their activities from home, such as working, studying, and even praying. The first 3 months of quarantine started from May to June, and then it was prolonged from July to August, as the number of the sick persons didn't show a chance. As the result of this quarantine, industries are having difficulties in managing their businesses. Laborers are laid off. Some of them have to stay at home until the company management's further notice. Most of them becoming jobless. Is this regulation effective enough to lessen the virus transmission and to avoid people from being infected by the disease? In Wuhan, the city where the virus found the first time, the government has succeeded to control the virus spreading. Now, it is nearly back to normal. The key is the Wuhan authorities as well as the China governments handling this national issue at very early time. They made right strategies and policies to avoid the virus spreading. The policies were well aided by all the members of the society. What about here in our country? I think the policy of social restriction is a bit late implemented. Moreover, there were a lot of people who didn't obey this regulation. They still gathered in public places. Most of them also didn't wear masks when they went outside. Seeing those facts, I can say that apart from other regulation, the social restriction is not quite effective. It seems that the government cannot act decisively, bringing this regulation to be strictly obeyed by all the members of the society. Until now, the number of people who is infected by the virus is increasing day by day. The key is not actually only on the government, but also on the society. People's awareness is needed to create new customs during the pandemic. Now, we are in the new normal period, when people can do their activities as usual with strictly held procedures. We don't know when this pandemic will be over, but surely we can make our own simple steps to avoid the virus spreading. Start from ourselves and the people around us like our family members. With positive awareness and cares, we can help the government control the virus transmission. Thank you.